Hey, good morning, everyone. Welcome to the December meeting of the Statewide Substance Use Response Working Group. I am Jessica Johnson, and I'm been asked to be the acting chair today. Welcome to everyone. We are going to start with agenda item number 1, which is a call to order and a roll call to establish quorum. I'll turn it over to SEI staff.
All right, I'll now call the roll in alphabetical order. Please indicate if you're present. Chelsea Cheatham.
Present.
Dr. Dixon.
Present.
Senator Doniate. Gina Flores O'Toole. Attorney General Ford. Senator Severs Gansert. Assemblywoman Hardy.
Present.
Shayla Holmes.
Present.
Jeffrey Iverson. Jessica Johnson.
Present.
Lisa Lee.
Present.
Debbie Nadler.
Present.
Angela Nichols.
Present.
Christine Payson.
Present.
Eric Schoen.
Yes, I'm here, present.
Steve Shell. Assemblywoman Thomas.
Present.
Dr. Woodard. All right, acting chair, we have a quorum.
Terrific. Thank you so much. We're going to move on to agenda item 2. Whomever is controlling the Zoom screen, if you don't mind sharing the PowerPoint slide, I think a Word document may be up now, if you don't mind, so we can all follow along together.
I apologize.
No worries. Thank you so much. All right, wonderful. Thank you. We're going to move on to item number 2, which is public comment. Public comment will be received in person at either any of the locations or via Zoom meeting. Should be limited to 3 minutes per person. And no action may be taken upon a matter raised during the period devoted to comments by the general public until the matter itself has been specifically included on the agenda. So I will go ahead and open. We'll start here in person, if that's all right, move to Carson City, and then move on Zoom into the phone. So anyone in Las Vegas here for public comment?
Giuseppe Mandel, representing There's No Hero in Heroin and the Alternative Peer Group Las Vegas. Thank you for allowing me to be here. Thank you for allowing me to learn from you guys of what's going on, and any services that I can offer with lived experience, more than welcome.
Thank you so much, Mr. Mandel. All right, any other public comment from Las Vegas? Seeing none, I will turn it to Carson City. Any public comment in Carson City?
Oma Woodrum for the record, no public comment in person in Carson City.
Thank you so much. Anyone on Zoom today for virtual participants or individuals who phoned in for public comment?
Madam Chair, this is
yes.
Eric Schoen. Yeah. May I?
Go ahead, Mr. Schoen, for public comment. Go ahead.
Yeah, so I'm actually on the SURG committee, but I didn't receive a link. So I may need to be promoted in order to be seen as a panelist. So that's number 1. Number 2, I also didn't receive an agenda ahead of time, or I couldn't find the email. Either one, it might be on me. But because of that, I'm not sure if this is in the agenda later on. I have to admit to being terribly confused about the purpose of the cross-sector task force. And I was hoping we could hear some clarity about how that's supposed to tie into the SURG committee, because it sounds like it's been sort of grafted onto that. And now I'm sort of lost between the purposes of the 2 or 3 committees. And I'm hoping we get some clarification about that today.
Thank you for your public comment, Mr. Schoen. I appreciate that. Other individuals on Zoom for public comment?
It looks like we have Assemblywoman Tolles.
All right, Assemblywoman Tolles, please provide the mic is yours.
Thank you so much. For the record, this is Jill Tolles, and I just wanted to say how wonderful it is to see your faces through the computer screen, and just how tremendously grateful I am to this committee and all the stakeholders that have provided input along the way. The staff has been phenomenal, and I am so excited to see a year's worth of work come to fruition today as you vote on these recommendations, and wanted to cheer you across the finish line and express my extreme gratitude.
Thank you so much for your public comment. Anyone else on the line for public comment?
No.
All right, seeing none, anyone
It looks like
oh,
one. We have a Rick Reich.
all right, Mr. Rick Reich, the floor is yours for public comment.
I'd just like to introduce myself. My name is Rick Reich. I am the Executive Director of Impact Exchange, the only harm reduction center down in Las Vegas. Thank you.
Thank you, Mr. Wright. Anyone else on the phone, on the Zoom for public comment? All right, seeing none, anyone who is called in on the phone for public comment? All right, thank you so much. I did see a comment in the chat that I just wanted to vocalize about. Mr. Schoen mentioned needing to be promoted to a panelist, and you have been, is my understanding. So thank you for that.
Yeah, thank you very much.
All right, let's move on to agenda item number 3, which is review and approve the minutes from the October 3rd SURG meeting. At this time, I'll give everyone a minute or so to look them over. But I would entertain a motion when you're ready to approve the October 3rd SURG minutes.
Debbie Nadler, for the record, I approve. I make a motion to approve.
Motion by Ms. Nadler. I'm looking for a second.
Lisa Lee, for the record, I'll second Debbie's motion to approve the minutes from the October meeting.
Thank you, Ms. Lee. So I have a motion and a second. All in favor, say aye.
Aye.
All right. Sounds like we've approved the minutes. Oh, sorry. Any abstention or any
Opposed?
opposed? Thank you. I got Terry here to help me with the Roberts rules today. Hopefully I'll keep it together. Hearing none. Any abstentions? All right, terrific. Now we've approved the minutes from the October 3rd meeting. Thank you. Let's move on to agenda item 4. I am going to turn this over to Dr. Terry Kearns to introduce our new SURG member, Assemblywoman Melissa Hardy. Dr. Kearns?
Thank you, Acting Chair. I would first like to thank former Assemblywoman Tolles for her dedication and hard work to the SURG, and for her continued participation in attending the meeting. And now that she is no longer in that role, the Nevada Assembly Minority Leader, Assemblywoman Titus, has appointed Assemblywoman Melissa Hardy, and I'd like to offer Assemblywoman Hardy the opportunity to introduce herself to the group.
Thank you for that introduction. And as you said, I'm Assemblywoman Melissa Hardy, and I represent Assembly District 22, which is in Clark County, the Henderson area. And I'm just honored to have been asked to serve on this committee. I know that this is such important work, and I'm just look forward to, excuse me, learning about this and, looking at the work that you've done over the last year, and then being a part of what we can do in this upcoming legislative session. This is my 3rd term. I was elected in 2018. And so I'm just really excited to be a part of this and to do this good work in our state, and to, after the session, continue to work on what we can do in this area. So it's an honor to be here and to be able to work with all of you and learn from all of you. Thank you.
Wonderful. Well, welcome, Assemblywoman Hardy. We'd be glad to have you, and thanks for being here today. Anything else, Dr. Kearns?
No, thank
Great.
you.
Wonderful. Let's move on to agenda item number 5, which is an update on the opioid litigation, settlement funds, and distribution. This is an information-only item, and I'm going to turn it over to Chief Deputy Attorney General Mark Kruger.
Hi, everyone. It's a pleasure being here. Mark Kruger for the record. I'm a Chief Deputy Attorney General with the Bureau of Consumer Protection, Attorney General's Office. I also want to congratulate and thank Assemblywoman Tolles for her service on this committee, and look forward to working with Assemblywoman Hardy. So I have previously provided updates on the kind of a chart on where we are. And so, as you guys know, we had several settlements, including settlements with distributors, as well as Johnson & Johnson or Janssen. And now we're pleased to be able to let you guys know we had a couple small, one small settlement, relatively small. And the reason for that is it was this company had a very small market share. But American Drug Stores, we had a settlement of $1,500,000 that's come in. And then the Mallinckrodt went through a bankruptcy. The bankruptcy judge approved the plan, and the money has now started to be distributed. We received $1,849,733.70. The exciting news, however, is we've also settled or joining the national settlement with Walmart. That will estimated we will receive sometime in May, after we get releases and everything else done. Approximately May, we should receive about $32,231,037.14. So that's the update for now on those. I will be eventually putting those into a chart and continuing on that chart, so we have one contiguous chart. But I haven't had an opportunity to do that yet, but I did want to share that exciting information for you. That's all I have.
Wonderful. Thank you for your update, Mr. Kruger. As an informational item, I just wanted to ask if any SURG members have any questions for Mr. Kruger while he's here about this informational item.
Debbie Nadler.
Wonderful. Debbie, go ahead. The floor is yours.
Yes, hi. Thank you so much for that update. As far as the lawsuits, and I guess I must be really confused about this, the actual money that we are holding right now, did you say we're actually holding on and we have over 200 million? Or that's how much we've won? Or I'm a little confused on.
That's all right. I think I can answer your question, Mark Kruger, again for the record. So as we get recoveries, whether it's from a bankruptcy distribution or a settlement in our litigation, and remember the state's litigation is the only litigation currently moving forward. However, we have entered into an intrastate allocation agreement for the allocation of all recoveries in the state's case, as well as in any of the counties or litigating cities cases. And so it's really a tool that we use to be able to enter into settlements and also fairly and equitably allocate the money throughout the state. Because as you guys know, especially working on this committee, opioids is and the effects of opioids is like fire, right? It doesn't care about state lines or county lines or city lines. It just impacts everyone. So what we've done is entered into certain settlements. The distributor settlement from the chart that I previously shared is going to be paid out over a period of time. Other settlements, we've received the money up front, or some settlements we received the bulk of it up front and there's a small holdback. And so I'm reporting on the settlement amounts in their totality. So as the money comes in, some of it has come in and been allocated. The allocated portion that goes to the state of Nevada gets deposited into the Resilient Fund for Nevada, which was created during the last session. So does that help explain the process a little bit better?
Yeah, a little bit better, but I have another question if you don't mind me asking. As far as the money that's allocated, I remember in the very beginning, we talked about money that was already earmarked by the feds, or I don't remember. I remember a portion, 10% maybe, was earmarked. And then would that be the attorney fees? Have we actually prepaid the attorneys with the money that we've received? Because I guess my concern is if we're sitting on this money, honestly, we're losing so many people every day, and I don't see anything happening. I know we've worked on this for the past year, 2 years, I feel like, and have the attorneys been prepaid and nothing else has been spent? And are you also, do we know how much, are you able to tell us how much we paid Mercer?
Well, Mark Kruger again for the record. So you have a lot of questions there, and I think I can break them down a little bit. First of all, the attorney's fees come off of the recoveries and go directly to the attorneys before the allocation is done. So, let me take that back. Costs come off before the allocation is done, and the costs get paid to the attorneys to reimburse the cost of litigation. The attorney's fees come off then after the allocation is done, and then the rest is deposited either in the state's share is deposited into the resilient fund, and each county and each litigating city's share is deposited into presumably their funds. Their funds are then going to be spent, hopefully in a lot of ways, in conjunction with the state plan that's been finalized now as of December 1st and published. And I think that's on an agenda item a little bit later, or you heard it yesterday. So that's really exciting. To answer your question about how the spending goes, though, is really appropriately answered by the Department of Health and Human Services, which manages the state plan and what consequently is required by law to then fund each individual program or service that's going to be funded. So they would be able to answer those questions a little bit better. But I do want to note for the record that there are other funding sources as well, in addition to these recoveries that have been implemented. So programs and services are in operation, and some of those programs and services are going to be further funded and supported by this money, and have been, as I understand it. But others, there'll be brand new ones probably potentially created. And again, I would probably refer you to Dawn Yohe with the Department of Health and Human Services, not to throw you under the bus, Dawn, but I think you're really the point person who can answer those questions better than me. My role is to more litigate and bring the money in so that it gets deposited, and then leave the expertise onto what plans and programs to all you folks as contributing members to the state plan.
Thank you so much for your answer, Mr. Kruger, and thanks for your questions, Ms. Nadler. I'm going to move to Lisa Lee, who's had her hand up for a few minutes. Thank Ms. Lee.
Thank you, Chair. Lisa Lee for the record. I just wanted to point to some of the unintended consequences of this litigation money. I've been really keeping tabs as a neurodivergent person myself on the current Adderall shortage, and not just Adderall, but also other medications, antibiotics, etc. And looking through all of these articles, which are, it seems like every day, there are numerous news sources that are reporting on this. Pharmacies are kind of scared. And I'm really seeing a repeat of what happened with the opioid crisis. And I just wanted to read this paragraph to all of you, because I really want us to be mindful of some of the unintended consequences that we're engaging in. It says, the early 2010s taught us that dependence and addiction don't simply disappear when the pills do. At that time, catastrophic regulation failures contributed to widespread opioid dependence and addiction. The government response to prescription opioid crisis focused on rapidly reducing supply, crackdowns on pill mills, tightened restrictions on prescribing, and reformulation of products to make them harder to snort and inject. This approach backfired, pushing many users onto the illicit market. And the reason I mention that is because we're starting to see the similar trend with neurodivergent folks who are dependent on these medications, and just kind of some of the ramifications of the opioid litigation, and especially with the pharmacies. And I just worry that we're going to prompt another mass casualty set of events, right? And so I want us to be mindful of these things that are much larger than us, and let that inform our decision-making here. So with that in mind, it does pertain to the opioid litigation, and this tangled web that's been woven. So thank you for your time.
Thank you for your comment, Ms. Lee. Any additional questions for Chief Deputy Kruger before he steps off the line? All right, hearing and seeing none. Thank you for your information and presentation today. The SURG really appreciates your continued updates on this.
No worries. Thank you.
Thank you. My understanding is that we're going to table agenda item number 6 for the January meeting to honor some additional updates that needed to be made. Is that correct, Dr. Kearns?
That is correct.
All right, wonderful. Let's move on to agenda item number 7, which is an update on the cross-sector task force to address overdoses. I'm going to turn it over to Dr. Terry Kearns for the update.
Thank you, Acting Chair. Before I start the update on the cross-sector task force, I'll try to address Eric Schoen's question on the 3 committees and the difference and what the 3 committees are doing. So as you all know, we have the Advisory Committee on a Resilient Nevada. We have the ACRN, the SURG, which is us meeting here today, and then the cross-sector task force. The Advisory Committee on Resilient Nevada is really focused on opiates, opiate policy, and the funding, and that goes into that state plan on how the funding from the Fund for Resilient Nevada will be used. They can also make recommendations for policy strictly on opiates. The SURG, our group, has a larger scope in the fact that we can look at all substances. So it's not just focused on opiates, and it's also policy and funding recommendations. So our scope's a little larger than what you see in the ACRN. And what we were finding is that through the process between the SURG and the ACRN, most of our recommendations for policy or funding are more mid to long-term type of recommendations. So the thought of bringing the 2 groups together, which also the legislation says that the 2 groups really should be working together because there's expertise among the 2 groups, is to try to tackle some shorter term goals. So looking at kind of a 6-month timeline, and there's really no funding. So it's to try to look at some existing programs that we can make some recommendations that can be implemented in a 6-month period. Does that kind of answer it better for you, Eric?
Yes, thank you. I appreciate that overview. So just to make sure that I've got this clear, really bringing the 2 of us together was to try to craft some short-term solutions that we could apply within 6 months.
That's correct.
Okay.
That is correct.
I appreciate that.
And now I'll go. Yeah, no problem, Eric. I'll give you a brief overview. I think the majority of the members here were at the meeting yesterday, but for those who were not, I'll give you a brief overview on what we talked about. The objectives of that cross-sector task force were to determine necessary actions to reduce the risk of overdoses in our communities, to prepare responses for the state and local jurisdictions in the event an increase in overdoses occur, and provide technical assistance, guidance, and resources to rapidly implement best practices to reduce the risk for overdoses, enhance capacity to respond to events, and recover should such overdose events occur. And we had a couple of presentations. There was one presentation, by Jamie Ross on the statewide partnership for the coalitions, and some of the emergent needs that were laid out from that presentation were training and awareness on naloxone and test strip availability, additional law enforcement training and equipment, and awareness of amphetamines mixed with opiates, And then community request growth of existing programs and support for secondary and tertiary prevention. There was also the opioid solutions for schools and youth with increasing ACEs, which is adverse childhood events, and PACEs, which is prevention of adverse childhood events. And then evidence-based programs in our schools, school collaboration with prevention specialists, and school to behavioral health pipelines. And she mentioned mindfulness, which is being done in one of the counties already in their school system in Churchill County. We also had from a presentation by one of our tribal partners who mentioned that the needs within the tribal community were that there are many needs identified on various levels. Some of these needs will need funding and some may not. Some may require additional staff, and there's a lack of budget to pay for additional staff. There was an example given of trying to pull data, but they have a position open and have not been able to fill the position to pull data because no one's applied for that position. Staff education regarding opiates and medication-assisted treatment, MAT, increase education and encouraging patients to try medication-assisted treatment. There's no capacity to generate team approach. You have missing roles, non-opiate pain management, those sorts of things. Staff training on both CPR and Narcan, community training on CPR and Narcan, and potentially coordinating that with PACE, which is the community coalition in the Elko area. Student prevention, AOD education, CPR, and Narcan training, and potentially coordinate with PACE, again, the community coalition in that area. And then supplies such as fentanyl test strips. The tracking for statistical purposes may include increased communication with EMS and or coroner, and they're lacking systems and staffing, and then assistance with coordinating with school for prevention and training activities. Then we had a section on the state plan and the needs assessment, and basically went through the sections of the state plan, which is section 1, the executive summary. Section 2 is the introduction. Section 3 is the methodology. Section 4 is the opioid impact in Nevada. Section 5 is the current system addressing opiates in Nevada. Section 6 is recommendations. Section 7 is a statewide plan. Section 8 is next steps. And it was mentioned that the needs assessment and the state plan were put together into one document. That there was a budget that was discussed that is going to be taken to the interim finance committee in January to move funds out of reserves. And there will be a request for proposals, an RFP with Nevada State Purchasing, and then continued mapping of opiate funding and projects throughout the state. Then from there, we went and talked about our next is operationalizing recommendations for the cross-sector task force. The expectations are to use a consensus model for decision-making. The action plan must leverage existing resources to the greatest degree possible, including existing federal funds. Think strategically to develop actions at the state level. Activities must be evidence-based and demonstrate effectiveness. This includes messaging. Considered implementation science, ready, willing, and able. Focus on health equities and addressing disparities, and balance the need for urgent action with planning. And then in operationalizing the recommendations, want to establish situational awareness with data and current activities, set the foundation for continued planning based on the Nevada Opiate Needs Assessment and State Plan, work accomplished by both the Advisory Committee for a Resilient Nevada and the statewide Substance Use Response Working Group, and then move from general recommendations to detailed actions. The Joint Committee Action Plan that we discussed yesterday really includes 3 areas. The 3 areas are the development of communications, access to care, and harm reduction. And what we decided at the end of the meeting was that all of the members of that cross-sector task force, which are all the ACRN members and the SURG members, will send out a poll to all of those members with these different plans that we came up with. And the members will then work on those polls and will assign two SMEs, one from the ACRN and one from the SURG, to each of the plans that they will then work on and develop those plans, and then provide a presentation on that at our next meeting, and then also providing the backup documentation and the poll information from them. And we hope to have the next meeting going over all this, hopefully the end of January or beginning of February. And that's my report. I will take any questions.
Wonderful. Thank you, Dr. Kearns, for your report. Do we have any questions from the SURG members on the update on the cross-sector task force?
Looks like Chelsea Cheatham and Debbie Nadler both have their hands raised, and Lisa Lee.
Okay. Wonderful. Chelsea Cheatham, did you have a question?
I do. Yes. Thank you, Chair.
Cheatham?
Yes. Hi. Can you hear me?
Yes.
Okay. Thank you. I just wanted some additional clarification and thank you, Dr. Kearns, on updating us on the cross-sector task force. But I needed some additional clarification on really the role of the cross-sector task force. I was under the impression that the cross-sector task force may be the vehicle where we would be able to put forth our harm reduction recommendations. But then I was also, I think at one point, thinking that we were going to, as subcommittees, put forth our recommendations, our 3 to 5 recommendations, and then have the ability to add additional harm reduction recommendations. And I just want to clarify where those harm reduction recommendations are going to be made.
I think there's 2 areas. So harm reduction is part of the plan for the cross-sector task force. That was one of the areas that I discussed, but there were specific ones such as, fentanyl test strips, distributing fentanyl test strips. It was more focused on programs that are already existing. But I think also within the SURG, the idea is to have harm reduction as a component of our recommendations. Again, this cross-sector is looking at existing programs, trying to take them from general and get into more specific action plans that we can really put into action within the next 6 months, or the programs that are already doing those, give those recommendations to them to help get the programs kind of kickstart it, to get those recommendations moving more at a state level, not at a specific one site, but that we can look at statewide. And then we also are still looking at the harm reduction recommendations on the SURG as well. Does that clarify? So I think both places are looking at harm reduction.
Okay, thank you.
Thanks. Any additional questions, Ms. Cheatham?
No additional questions.
All right. Wonderful. Lisa Lee, the floor is yours.
Thank you, Chair. Lisa Lee for the record. My question was similar to Chelsea's. I feel like there's been a lot of confusion around where harm reduction fits, or at least how I've understood what is happening, which is really murky. It's been very muddy sitting on this committee, or on this committee, as well as the subcommittee, the treatment and recovery subcommittee, knowing where harm reduction is going to be. And I feel like it's been kind of a game of cups or shells, right? Where things are moving and it's going to be over here. No, it's going to be over here. And so where does harm reduction fit? And the other thing is, the landscape is changing very rapidly, right? What we're seeing now is a lot of people moving from injection drug use and long-term injection drug use to smoking. And so, yes, that is great as a harm reduction strategy. It improves vascular health. It, takes away a lot of risk as far as HIV and hepatitis C transmission. There's a lot of evidence around safe smoking, and that has not been addressed because we haven't had a place to address it. And it could be something that could be very helpful in the upcoming legislative session to allow current harm reduction programs to offer safe smoking supplies as people kind of transition off of injection drug use. And then those programs are missing a whole bunch of people who are no longer coming in for safe injection equipment per se, right? Because they're not able to distribute safe smoking supplies and really keep up with the trends that we're seeing on the ground. And so where do we put this, right? Where can we bring this? I feel like this has been a very paternalistic process in which things are sort of handed to us. And like those of us that are on the ground that are really trying to save people's lives every single day. And what we're seeing, we really don't have a space to put that. And so much to Ms. Cheatham's comment, I just wanted to support that it has felt very confusing around where to sort of lay these priorities around harm reduction. Thank you.
Yeah. First, thank both Ms. Cheatham and Ms. Lee for your comments. They're much appreciated. And I think from the SURG perspective, we had harm reduction as under prevention as a tertiary prevention. And rather than changing it mid-year, we kept it in. And in conversations, I do not want to speak for Dr. Woodard because she's not here. I know there was discussion in some of our meetings about perhaps having a special meeting where we focus just on harm reduction and go through some of these conversations and talk about that and, what's the path forward. So, without her being here, I don't want to commit or, say, but I know that is in her mind and something that we are looking at. So I know we will readdress that in the coming year, but you guys are heard. Please understand that you are heard because we know you are out there doing this every day, and thank you for your work. And something that we do want to make sure that you understand you are heard. So.
Thank you.
Chair Thomas, or Chair Johnson, I'm sorry. If I could just say, over the next year is great, but people are dying every day and the legislative session starts in 2 months. And so, I'm sorry if I feel a sense of dire urgency, but honestly, I've lost count of the people. I'm that's not hyperbole. That's the facts that a lot of us, we're tired. We've lost so many people. And I feel this tremendous sense of urgency. And to be put off constantly just feels, I don't even know if I have a name for the feeling, but we can't put it off any longer. Thank you.
Thank you for raising this, Ms. Lee. I see all the staff on here taking notes. So let's make a plan to move these pieces forward sooner rather than later. Thank you. Thank you for your comments. Next on my list is Debbie Nadler. Debbie, the floor is yours.
Thank you. Lisa and Chelsea, I fully agree with everything that y'all have said. And we are, Lisa, very good point. We are losing so many people a day, and it is urgent and it is dire, and legislation is meeting very soon. And specifically, you all know I lost my son. He was caught in this web 10 years ago. I had to detox him myself. I had to send him out of state for treatment, 8 states to be exact, because there was nothing in our state to help him. And he's gone and I can't bring him back. So I'm trying my best, not only for education and prevention, but I have mothers whose children are actively using. Just 3 in the past 2 weeks. I'm sorry, that's my dog ringing the doorbell. Yeah, don't ever teach your dog to do that. 3 people fell out of the system just this past week. And I just couldn't believe it, that it was still happening. I mean, I thought after 10 years, something would be fixed. But now with fentanyl and everything else, and as Lisa said, with the shortage on Adderall and now Gabapentin and everything else, it's dire. It is dire. There is really one place to detox. I'm sorry, two that I know of. And they were turned away. One was turned away, one was let in for 2 days and then put back out on the street. And this is an emergency, and we need a separate thing for harm reduction. Like I said, I've always been into education prevention, but this, I can't sit back and watch another child die. And I strongly, wholeheartedly believe we have got to focus on something now, not 6 months, but now. And I'm sorry I sound passionate, but I agree with Lisa and Chelsea. Thank you.
Thank you for your comments, Ms. Nadler. Always appreciate your advocacy and bringing this to the forefront. Thank you. Next on my list is Eric Schoen.
Yeah, thank you, Madam Chair. And I wish our previous panelists would not apologize for their passion. I think it's a part of helping to communicate how important this message is. So I appreciate that passion is communicated. It's what I think cuts through the noise sometimes. So thank you both, Lisa and Debbie. So I have a couple of comments. One, I just want to back the need to really prioritize harm reduction. The two statewide committees that I'm a part of, Resilient 8, not committees, coalitions that I'm a part of, Resilient 8, Formidable 14. Harm reduction is one of the areas that we're making the biggest strides in rural Nevada. And so it's cost effective, right? It's one of the best ways to get our bang for our buck. And it helps to make a huge impact and a positive impact in all of these communities by addressing stigma and providing solutions that really help to keep people alive. So I agree. There's an urgency around harm reduction throughout the entire state. And I want to follow up on yesterday's presentation at the cross-sector task force. One of the things that really confused me, and I know I'm not the only one now, which is like, am I the only one? Because this is not making sense to me. There were some funding numbers presented yesterday, which I don't think I had the entire context for. But one of the things, so it was like 6 or 7 different priorities. And pertinent to this conversation on harm reduction, there was $140,000 that was allocated to harm reduction for year 1, year 2, year 3, which is woefully short. So I would like some further context on what those numbers were relative to other numbers that might also be at play, which maybe having that context would help me not to have such a strong reaction to what seemed to be a really underrepresented amount of money that was needed for that. And I think I heard yesterday that having some sort of entire funding map where we as committees on both sides, ACORN and SURG, as well as the cross-sector task force, if we had that to reference, would be hugely helpful. So I guess there's 2 things in there. One, is there such a map? And secondly, can you explain those numbers that we saw yesterday?
Dr. Kearns, did you want to respond or hand it over?
I was just going to say, I cannot explain those. I know that presentation was Dawn Yohe. She, I believe, is on the phone. I don't know if she's prepared to address this. Dawn.
Good morning. This is Dawn Yohe, for the record. So thank you for your question, Eric. I think it is important to know the background and the context. We are doing fund mapping that we will be sharing because it is important for everybody to understand, like, the way we use the funds in the Fund for Resilient Nevada is just a very small portion of what's actually happening in the entire state. And so we're really mapping to SOR right now because they have a lot of money going towards harm reduction. So I can find out some of the specific numbers for you. And if you give me some time, I can get back to you.
Sure. So I guess I just to sort of synthesize, the numbers presented yesterday were just for the funds from the Funds for Resilient Nevada, and not referencing any of the other funds that might already be plans for. And okay, that would be really helpful. Yeah.
Yeah, that's correct. And then also, it's just the start. It doesn't mean that more money is not going to go into those areas later on. We just need to make sure that the state has the capacity to be able to implement the projects with evidence-based programming and are able to be sustainable. So let me get some of those numbers for you, and I'm happy to talk to you a little bit more about that.
I appreciate it. And thanks so much, Dawn. And then one last comment, Madam Chair.
Go ahead.
Thank you. I appreciate it. I know I'm begging your indulgence. So I think so Lisa's made an important comment the last couple of meetings, which is this has felt like a paternalistic process, and that it kind of feels like we're being presented the information. And at first I wasn't quite sure, what she was referencing, but now that I've heard it a second time, I think she's on to something. And that is, I know that ostensibly the role we play in providing advice or providing our perspectives is important for guiding overall policy decisions and or maybe even funding recommendations. But where I feel like might be a disconnect is I don't know the impact, like the decisions that are being made at a funding level or a budgetary level. I don't know how much of what we are contributing is factoring into that. And I think if we had a better idea of how our input, I guess what I'm saying is it'd be nice to know if we have a direct impact on that or a very indirect impact on that, and our role in both the SURG subcommittee as well as the cross-sector task force, if that makes sense.
Yeah, thank you for your comment. Dr. Kearns, is there any comment that you'd like to make at this time regarding the cross-sector task force? I know the next is the presentation on the annual report of the SURG, which might answer the second part of that.
Yeah, it may answer some of that, I think. And I do know, Eric, that all of the reports, both the ACRN report and then our report, goes to the director's office for DHHS. And that information is factored in too. So the recommendations that both groups make is used in the decision making. I can't speak to what the process is. I just know that piece of it. And the other piece is some of the recommendations we make on policy. Our report, which we are going to be finalizing, will be going to legislators as well. So that's the policy piece where we can have an impact on policy as well.
All right, I appreciate that. Thank you.
Yeah.
Thank you so much.
And I would, if I can indulge, Dawn, do you have anything you would like to add for the input of the ACRN report or the SURG report to the director's office?
Yeah, this is Dawn. We do take a lot of what the SURG and what the ACRN has done as far as recommendations, what the reports you have given to the director's office. We look at those, we're trying to implement everything we can. We only have a finite amount of funds. It has to last us, we get a small amount of funds every year for the next 18 years. Yes, we got a larger amount, but to be able to make things sustainable, it's really not a lot of money every year. You're looking at, $6 to $9 million a year that we're able to allocate out. And so we take all of your recommendations from your reports. We're also taking a lot of the subject matter experts reports who have given us information about what they believe needs to go into abatement strategies for the state of Nevada. So it's not just a few people behind a door making decisions. It's taking all of this into account, plus public comment in meetings and some of what the public has to say. All of that is being taken into account, other government entities. So, happy to talk about it more, but we're all taking all of the recommendations that we can, and we want to fund everything, but we can't. So that's why we're doing all of the fund mapping and the project mapping at this point.
Thank you so much, Dawn. I appreciate everyone's comments on this and fantastic questions and commentary from so many of our advocates in the group. I appreciate that. Let's move on to agenda item number 8, which is to review the draft annual report of the SURG. This was one of the many attachments that we received from Dr. Kearns. And if you don't have that in front of you, we will put it on the screen. Thank you. Amazing SEI team. So I'll turn this over to Dr. Kearns to walk us through the draft report of the SURG. This is for possible action. So thank you. Dr. Kearns, the floor is yours.
Thank you, Acting Chair. As was just mentioned, one of the things that we do every year is draft this annual report. And as part of the annual report for this year, we are making recommendations. And the way that we have put the annual report together this year is that there is an executive summary, the introduction and background, our methodology that we used, the recommendations that the committee through the subcommittees came up with, then our future considerations, the conclusions and appendages to support the document. From there, I'm going to turn it over to Laura from the SEI team, who's going to delve deeper into the report.
Thank you, Dr. Kearns. And so, unfortunately, my internet was not stable, so I'm just on the phone, but Kelly is going to be managing the screen, taking you through the report, and I'll be just talking you through at kind of a high level, but certainly welcome any questions along the way. So Dr. Kearns just covered the table of contents. Kelly, if we can move to the executive summary, and just let me know when you're there.
She's on the executive summary page.
Sorry, Laura, I was muted. We're on the executive summary.
Thank you so much. And so you can see that this has highlight there. So update with final recommendations. That's what you're doing today. And in this executive summary, Assemblywoman Tolles did take a look at this and recommended that we keep the recommendations as brief as possible, because that is really all that the legislators will have time to look at. So it really just lays them out here, and they are in this part of the report in order by subcommittee, but that does not have to be how you ultimately do it. You can we can change that however you like. And you will see under prevention, if you scroll down to number 8, support harm reduction. So as Dr. Kearns said earlier, this was embedded with prevention for the time being. That can also change at a later date. And so this is what the prevention subcommittee put forward to support harm reduction. So you can see items A, and then on the next page, B, and then C. I won't read through these because we'll have time. We're going to dig into the specific recommendations as soon as we get to the next item. This is just kind of an overview of the report. Then we've got treatment and recovery and the recommendations they put forward, 6 recommendations there. And then finally, the 4 recommendations from response on the next page. And then Kelly, I'm going to move on to introduction and background. So this is just citing, yes, can you hear me?
Yes, we are there.
Oh, okay. And so this is just citing some of the testimony that was given to create Assembly Bill 374 that created the SURG. And we added some more current data on drug-related overdose deaths. And so you can see those in table 1, and then moving down to table 2, and then some summaries with the change over time. You can see from 2020 to 2021, and it's just some italicized text explaining where that data comes from and what it describes. And then there's just some explanation of how the SURG was created, how members were appointed, and then the intent of the legislation comes from that first meeting that where Dr. Woodard described some of that information. Roles and responsibilities, the bylaws, we'll review some of that in January with an update to those bylaws. as Dr. Kearns mentioned, overview and update on Nevada's opioid litigation. So this is just summarizing what Chief Kruger had presented in previous meetings to the SURG, and then there's specifics going down to the next page. There's specifics on the declaration of findings, contingent fee contracts, Second Amendment amended complaint, One Nevada agreement. All those are still available online. This highlighted placeholder is just for the brief update that Chief Kruger provided today, so we'll be adding that in. The methodology, I just would draw your attention to that in terms of how the process went forward in creating the subcommittees to have a manageable process for all of the members to bring their issues, concerns, recommendations to the table, and to have the opportunity to discuss that and then have those raised up to the broader SURG at those quarterly meetings, and you know, the opportunity to have subject matter experts presenting. We show here also how it was determined which elements of the legislation in AB 374, how those aligned with the different subcommittees. And so those can be reviewed going forward as well. And then, so I'm just scrolling down through that on my end, Kelly, looking through those different elements of the legislation that got assigned, and then finally to the cross-cutting items that went across all of the different subcommittees. And then we also introduced a weighting process as just a way to aggregate the priority interests of the subcommittee members and put that forward then to the SURG, and ultimately came up with, you know, the 5 to 10 recommendations that each subcommittee was asked to bring forward. And it just describes further how that went through in the different meetings with the SURG. And then scrolling down to the recommendations, this is on page 12, Kelly, and you can see again that's highlighted there, update the SURG meeting results. So the way that, as we were looking through all the recommendations that were advanced, Assemblywoman Tolles had suggested, you know, maybe we want to put these forward as the SURG as a whole rather than having them split out by subcommittees. But again, that's open for discussion, and you all can decide about that, what you want to do. As we were going through, looking at all those recommendations, looking at how they mapped onto the legislation in AB 374 and those different elements under section 10, subsection 1, paragraphs A through Q, we saw some themes coming up, and that's how these are arrayed. So there were things that were criminal justice, then data collection, education, finance coordination, legislative, regulatory coordination, service coordination, and workforce development. This was just, again, a scheme to try to look at different ways that you can organize all of the recommendations. And because they mapped onto that AB 374, section 10, subsection 1, it seemed like a reasonable way to present this, but it's really up to the SURG members how you want to do this. And so you can here, each recommendation is assigned under a particular theme, and then it specifies which paragraph this mapped on, that particular recommendation mapped onto. And sometimes it might be elements of the justification or the action step that may be mapped to that paragraph as well. And in some cases, things might map onto more than one element of the legislation. So we try to include that information as well. And on the next agenda item is where you're going to dig into these recommendations and see how you want to move forward, which things you want to discuss, where there are overlapping items. So Kelly, I'm scrolling just down through this to come to some of the highlights where there are some of these overlapping areas. Let's see, I'm going through page 16, 17, 18. So if I go down to page 20 of the report on the support harm reduction, this is item number 12. So we highlighted expand access to MAT and recovery support for SUD, limit barriers to individuals, et cetera, because these were things that were cross-cutting across the subcommittees. And so in this case, the prevention subcommittee adopted some of the language that came from the treatment and recovery subcommittee. So you'll see those kind of highlights that are just intended to draw your attention to the fact that there needs to be specific discussion on these to resolve where you want this recommendation to reside and how you want to finalize that. And then there are some others like that. Let's see. Well, you'll actually see the numbers on the agenda for how those cross over with different subcommittees. So, and then Kelly, I'm moving all the way down to page 25. So you have some items for future consideration. These were things that there just wasn't time to get to in this iteration. And so that conflict between the Good Samaritan Drug Overdose Act and drug-induced homicide law. And then the second bullet, policy change to cover non-pharmacological or complementary treatments for pain. And then the conclusion is fairly short, really just acknowledging the tremendous work of, and the expertise that all the members bring to the SURG, the extraordinary work within the Attorney General's office to bring in more funds to this state, and looking forward, the need for ongoing commitment from state agencies to support implementation. And, as you heard from Ms. Yohe, they're looking at how they can best implement these recommendations and what can be prioritized. The rest of the report, going down to page 27, the appendix starts, so you have the listing of all the members. You'll have the bylaws in there. You'll have more detailed information on the settlements. We didn't necessarily want to put all that into the body of the report, so that is also going to be updated with recent updates from Chief Kruger. You can see there's all the different settlements are listed there. The bylaws, once those get updated, those will also be added into the appendix. And that is basically the overview of the annual report. And as I said, you'll have the opportunity on the next agenda item to dig into the recommendations. But if there are other questions, concerns, suggestions for the annual report, I'm happy to hear from everyone.
Wonderful. Thank you so much, Ms. Hale and Dr. Kearns, for the overview of the report and for the team who compiled this report as a draft put together. Before I open to questions from the group, I had a quick question for Dr. Kearns. So it's part of the SURG's legislative obligations to create this report annually. It's due in January, is that correct?
That's correct, the end of January. So we need to get everything really to the point where we can get it approved so that we can have the whole report ready for the next meeting, and then can go to all the people it needs to go to. It goes to more than the legislators, but all the people it needs to go to by the end of the month January of 2023.
Terrific. Thank you so much. So before I open this to comments and questions from the committee, because agenda item number 9 is specifically like getting our elbows dirty with the recommendations. So they're in here in draft form is my understanding. So if you have comments on specific recommendations, I'd ask you to bring them up on the next agenda item. But as far as looking through this report, so if you have comments on other elements of the structure or questions related to different sections that don't include the recommendations, which are pages I made a note and then I lost it. My apologies. 12 to the top of page 25 are where the recommendations are. We will go over those in the next agenda item. So given that ask, I'm going to open to comments or questions on other sections of the report beside the recommendations, since we'll go over those next. Debbie Nadler, I see your hand up.
Yes, Debbie Nadler for the record. I do have a comment or a question, not sure. I know the SURG term, I believe, runs through 2023, September 2023, if I'm not mistaken. And I feel as though all of us have been working so diligently and nonstop that by ending our term in September 2023, and I said it the other day, it's like taking a quarterback before the Super Bowl. We've all invested so much of our time and our input. I feel like we should continue, especially since we're going into the next year meeting and making recommendations. I think I questioned about this before. How do we extend? And I remember somebody, it might have been Lisa, if I'm not mistaken, somebody else brought this up a while ago about our terms and when they're up. I'm not sure how this is working.
Great. Thank you. Thank you for your question, Debbie. I'm going to turn it over to Dr. Kearns, who has the term limits in front of her at the moment. Dr. Kearns?
Yeah, we had discussed this just to refresh everyone's memory in prior SURG meetings, because Debbie's correct. Lisa Lee made the recommendation that not all terms should expire at the same time, so that we can have some consistency from term to term. So in looking back at the legislation, our legislators did a really good job and did that for us. So they laid out the initial terms, which started January 1st of 2023, and about half of our members would expire in 1 year. Their terms would expire in 1 year. And then the other half their initial term would go 2 years. So basically it's most of our legislators, the Attorney General, the DHHS designee, the one representative of a local government entity that provides or oversees the provision of human services in a county whose population is 700,000 or more, whose population is 100,000 or more, but less than 700,000, whose population is less than 100,000, and one provider of healthcare with expertise in medicine for the treatment of substance use disorder. Those are the terms that would expire on January 1st of 2023. So we need to get reappointments from our legislators. Some of those have changed, some remained the same, but we needed to reach out and make sure that they want to either reappoint or appoint new people. And then we are in the process of getting all of those updated, reaching out to the director of DHHS, which we have, and the Attorney General, and all of our other representatives that I've told you about. So that's one of the things that we will be doing, but only half of the membership could potentially change, and it could be less than half because some will likely be reappointed.
Great, thank you.
Does that address your question, Debbie?
I was just going to say, Debbie, did that answer your question?
Yes, thank you so much. Thank you.
Wonderful. Next on my list for questions is Shayla Holmes. Shayla, the mic is yours.
Thank you, Shayla Holmes, for the record. I'm sorry if this bleeds over into agenda item number 9, but I think if we are not listing our recommendations in any certain order, that perhaps we can add a sentence or language identifying that they're not listed in order of priority or something along those lines, just to make that clear.
Yes, thank you for that suggestion. I think that's a wonderful suggestion. So in the where the recommendation section on page 12, including something that these recommendations are not listed in a particular prioritized order. I think that makes sense. Wonderful. Any other, thank you for that feedback, Shayla. Anyone else comments or questions about the section of report that's not the recommendations, since we'll do that next. All right. I'm going to ask Dr. Kearns, because my Roberts rules get a little rusty here. This is for possible action. So how can the search committee proceed here?
I think next we have to go to the recommendations and talk about the recommendations.
And then come back to agenda item 8?
Yeah, because we have, is that correct? Kelly, go ahead.
Thank you, Kelly Marshall, go ahead.
So I believe that what we were asking for was for the SURG to approve the structure and the approach to the report, including, the layout of methodology recommendations. And you could potentially provide direction about whether you wanted them by subcommittee or by those cross themes. So they currently appear in the executive summary as by subcommittee, and they appear beginning on page 12, as you can see here, by those themes. And so I think it was like approval of the structure and the content of the report minus the finalization of the recommendations, which is on the next section. So for example, the suggestion about adding the sentence that recommendations are not listed in any particular order of priority, that could be part of a motion that you would make now. And I would defer to obviously our DAGs if they have any other direction as well.
Thank you, Homa Woodrum, for the record. So as Ms. Marshall just described, envision this as like a modular approach. So you've lifted one piece of this out for the next agenda item, but everything else that's remaining, you could sort of resolve it with a motion and vote now, and then move to kind of more specifics about the recommendations. So someone could bring a motion and say that they move to approve the structure and thematics of this document, including some clarifying language to the effect that the order is not, indication of priority. Then you could second, go to a vote, discussion, vote, et cetera. And then you'll move into agenda item 9 and do kind of a deep dive into recommendations. And that helps you keep your motions clear for minute purposes, right? So that you don't feel like you're jumping back and forth. But if you did, for some reason, learn something while you're discussing the recommendations and wanted to reopen the prior item for any other modifications to your vote, you could do that too. Because that sometimes happens, right? When you're discussing and realize, oh, maybe a clarification should go back into another section. So at this point, you can present a motion subject to the clarification about the order of precedence, and then move to your next agenda item if you like.
Wonderful. Thank you for that clarification. Any further discussion from this group, including the way the recommendations are presented, whether by cross-sector or by subcommittee, prior to entertaining a motion? Terrific. Shayla Holmes, the mic is yours.
Thank you, Shayla Holmes, for the record. I am just curious, perhaps, I don't know if anybody else is having similar thoughts, but would it be when I'm thinking of a third party reading this, a legislator, to have the recommendations consistently presented in the executive summary and then also down when they get into further detail, would it, for somebody not necessarily reading the whole document, would they recognize that those are the same recommendations since they're presented in two different ways? I see Kelly.
Kelly Marshall.
Go ahead,
Madam Chair. So
go ahead, Kelly.
they are presented in two different ways to give you two options. So one option is the way they would appear in the executive summary currently. The other is the way they appear as recommendations here. And the request was that you provide direction to us, and then they would consistently appear in the same format in both places.
Thank you for the clarification, Kelly. I appreciate that. Shayla, thoughts on which approach?
Yeah, I prefer the breakdown by subject. I think that there's so many cross sectors and different points that go across the different subcommittees. And we found, at least in our subcommittee, varying points where we were like, wait, is this or is this that? And I think that breaking it down by topics such as criminal justice, data collection, education, et cetera, for an individual not involved with the process would make more sense. And that's my opinion.
Wonderful. Thank you, Ms. Holmes. So one vote in favor, sort of in the way that it's broken down in the body of the report. Thank you for that explanation. Next on my list is Eric Schoen.
Yeah, thank you, Madam Chair. So I am going to be Switzerland in this, in that I think the way it's first listed between the three different subcommittees is more intuitive. So if I am a legislator without a lot of time, I think it's going to make more sense to compartmentalize it into those three different subcommittees. On the other hand, Shayla just made a very compelling point, because if you look at this, the way it's presented down below, I think it provides a little bit more direct guidance on sort of how the solutions might affect the overall picture, whether it's data collection or policy or what have you. So yeah, I'm ambivalent at the moment. So I'm open to being swayed by other perspectives.
Wonderful. Thank you so much, Mr. Schoen. Lisa Lee, hopefully you're a deciding discussion point here.
Thank you, Chair. Lisa Lee for the record. One, I wanted to point out the inconsistency, page 31 and 32 of the membership and terms. From what I understand, those dates do not match the amended bylaws. They have different term end dates. So I wanted to make sure that there was alignment there, because those dates do appear to be an error from what I'm showing of term expiration dates for many of the positions on January 1st, 2023, and then the subsequent positions on January 1st, 2024. That is not what I'm seeing in this report. The other thing is, I'm wondering if we can just table this agenda item, because I feel like it goes after our recommendations, that once we get to that, which is really the whole reason why we exist, is to make those recommendations. I'm wondering if we'll have additional insight on how this can look. And so I'm just wondering if we could talk about the recommendations, the next agenda item, and then come back to this one, if that would make more sense, and we would have some additional thoughts on how this should be formatted, et cetera, if that makes sense. Thank you.
Yeah, thank you, Lisa. I want to summarize the second part of what you said. That is, if there was a motion that came forward, that it would be with the structure and the thematics, without the order or the recommendations in place, and that we would discuss sort of the layout of the recommendations in agenda item number 9 is sort of what your point of discussion is. Did I get that correct?
Yes, Chair, that makes the most sense to me, is that these to me seem to be sort of an in order process. and it seems like we're doing it out of order is what it feels like. I feel like we need to make the recommendations, and then it feels like we'll all have additional insight on how we would like that kind of packaged for the various folks that are going to receive this annual report in January.
Great, thank you. And then to your first point, that if there was a motion that moved forward on number 8, that it would include looking through the appendix item that has the term limits to reconcile them with the bylaws. Terrific. I see you nodding your head. Okay, great, wonderful, thank you. I'm seeing one other discussion point from Debbie Nadler. Debbie, the floor is yours.
I just wanted to agree with Lisa Lee on what she said about the recommendations, that we move forward and do those, and perhaps that'll give us some clarity on everything else. I just agree with Lisa. Thank you.
Perfect. Thank you, Ms. Nadler. Assemblywoman Thomas in Las Vegas, go ahead.
Thank you, and thank you for the presentation also. I'm going to be that one that says no to the previous suggestions. And the reason why I'm saying it, if I understand correctly, the only thing that we are supposed to decide right now is a format. That if this is a good format, then we can say yes or no to the format. And then we can discuss recommendations. To me, I think that we are, putting the horse in the cart in different directions here. And it's just that simple, that if we can agree or disagree on the format, then we can proceed on with the recommendations. I don't understand, why we have to go with the recommendations and then come back and say, oh, I agree on the format. It just doesn't make sense to me.
Okay, thank you for your comment. I really appreciate that discussion. Okay. Any further discussion on this agenda item, or are we ready to, at this time, I would entertain a motion on the SURG structure and thematics, including an amended sentence on the recommendations page, a review of the bylaws and term limits, and I guess excluding the order of the recommendations, that section to be discussed on number 9. How'd I do? Perfect.
So moved.
All right, I hear a motion in the Las Vegas room from Assemblywoman Thomas.
I'll second.
And a second in the Las Vegas room from Dr. Dixon. All in favor say aye.
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 Those opposed? And any abstentions? All right, the draft annual report of the SURG has been approved. Great work, everyone. In advance of number 9, as we move to agenda, before we move to agenda item number 9, I'd like to offer everyone a couple-minute break as we're about at the halfway point of our meeting here, and recognizing that folks may need a little bit of time. So by my watch, it is 10:27. So if we could come back at 10:35. Then it gives folks a little bit extra of a 5-minute break to stretch your legs and look at not your computer screen for a moment. So let's return at 10:35. Thank you. Back, everyone. Hopefully that was a refreshing break time for you all to stretch your legs and move around a little bit. So we're going to move on to agenda item number 9. This is approval of recommendations for the annual report. I am going to turn the floor over to Kelly Marshall, who is going to walk us through the strategy for this. This component is really important So Kelly, over to you to give us our marching orders. Thank you.
Thank you, Madam Chair. Kelly Marshall for the record. So as Chair described, this is approval of recommendations for the annual report, the structure of which you just approved. Here is a proposed approach for review and approval of the recommendations, and this is what we would suggest could be in order. There are cross-cutting or duplicative items. So at our previous SURG meeting in October, preliminary recommendations were presented. Then Vice Chair Assemblywoman Tolles summarized at the end of that meeting some ideas for consolidation, and those went back to subcommittees. And in some cases, subcommittees built out recommendations or actually retained the recommendation and then potentially expanded it. So we identified that recommendations as they appear in this document. So this is the handout that was posted and provided to you. That is the recommendations worksheet. We thought it would be easier to work in this than the full report, but it would be that section of the report that began on page 12 and went to the top of page 25. So the first thing that we would suggest is reviewing those clearly identified cross-cutting or duplicative items, which are recommendations 11, 12, and then 16 and 17, and they go together in that way. 11 and 12 go together, and then 16 and 17 are complementary to each other. The next step would be to identify items for discussion that are not duplicative, but which a member wishes to discuss prior to approval of the recommendations. And so that would be you identifying by number. There is a recommendation I would like to have further discussion on. If you are fine with the recommendations as is, the next thing would be to vote on those other recommendations. So please excuse the fact it says consent agenda. We're not using it as a consent agenda per se, but we're using it as a vote on a package of the other recommendations that no member has pulled for further discussion. So under bullet point 2, you would be identifying by number the ones you would like to pull for discussion. You would then vote on everything that remained as a package and say we're going to accept those, and then we will tackle the remaining items that were pulled for discussion, and you could then have separate votes on those specific discussion items. So, Madam Chair, I would just pause there to see if that approach works for the SURG subcommittee or committee, excuse me.
Wonderful. Thank you so much, Ms. Marshall. Any questions about the proposed approach from committee members? Debbie Nadler, the floor is yours.
Hi, Debbie Nadler for the record. Is this somewhere where we could bring in something new that we possibly could discuss next time? Something that's kind of part of it, but it's something with the DEA that they want to bring back to Vegas, actually to the state of Nevada. It's called Operation Engage. And I don't know if this is somewhere we discuss that, or we just table it and discuss it at another time. I'm not sure.
That's a great question. So in this proposed approach, my understanding is that we're reviewing what's in here. Is there opportunity for new items at this time? My understanding is that there's not opportunity for new items at this time, but I'm asking staff to the committee or those familiar with what was decided in October.
Kelly Marshall, for the record, I would defer to the Deputy Attorney General.
Homa Woodrum for the record. I believe this might address the member's question. There is item number 10 where you could identify things for a future meeting. If the question is whether the suggestion would be folded into the report, I guess that's my question to you. Are you asking whether you could raise them for a future discussion, or are you asking whether or not there's an avenue to incorporate new recommendations into this report?
Well, I'd like to recommend them for this report, but if not, then another time, because speaking to the person who's the outreach with the DEA, and they've done it in 15 states, and they'd like to come back here. So I'm in direct contact with them. So it's a great.
Absolutely. So from an open meeting law standpoint, you're trying to, the goal is to be transparent and disclose to the public or anyone who would have also been interested in that subject that it was going to come up today, right? So you wouldn't want to have an agenda item that just says, for example, discuss recommendations, and you don't necessarily know what new recommendations there might be, because there might be other people who would have input or seek information or that sort of thing. So my recommendation would be that you may want to have it as something agendized for a future meeting so that anybody else who was interested in that subject could participate. Because at this point, if someone had looked at the agenda and the attachments and things that were available, they wouldn't have been on notice that this might be something that would be discussed and voted on. So that would be my recommendation, is to maybe save the thought for agenda item 10 and tackle what was noticed.
And that's what I thought. I just didn't know how to approach that. But yeah, thank you.
Okay, thank you for asking the clarification question, Debbie. All right, I'm not seeing any other questions from the SURG committee, Ms. Marshall, so go ahead and proceed.
Great. So I'm going to toggle between the PowerPoint, Kelly Marshall for the record. I'm going to toggle between the PowerPoint and the recommendations worksheet. And so we will move to the recommendations worksheet in a moment, but I wanted to elevate items recommendations 11 and 12 for you. So this is under the service coordination category, and you can see that they both recommendations correspond to AB 374, section 10, subsection 1, paragraphs E and F. So recommendation 11, which came from the Treatment and Recovery Subcommittee, was to expand access to MAT and recovery support for SUD, to limit barriers to individuals seeking treatment regardless of the ability to pay, and encourage the use of the hub and spoke systems, as well as recovery support, including use and promotion of telehealth.